Welcome back to Face the Nation. We want to pick up where we left off with the Surgeon General, Dr. Jerome Adams. And I just want to button up where we left off on the matter of the cruise ship. If someone is exposed and testing positive, will they be kept in the state of California?
Some of those, well, we're still working out where we can best put those folks. You have to understand, these are four.
But they dock tomorrow.
These are four, yes, and that plan is being developed right now. There are almost 4,000 people on that cruise ship. We're working with the Department of Defense. The most important thing for American people to know is that folks who test positive will be kept isolated so that they cannot expose other people. We don't want to put communities at risk.
But people who do test positive could be dispersed to military bases around the country?
Well, we're going to try to keep them as contained as possible, but we're going to make sure, and as close as possible, but we're going to make sure they're in a place that we feel we can keep them from exposing the rest of the community.
And we should expect a decision on that by, what, the 4 p.m. meeting that you have at the White House every day?
Well, exactly. And again, I would refer you to Ambassador Birx for more information on that. We want to make sure the American people know that we're prioritizing the health of the people on that ship, getting them off the ship as quickly as possible, as safely as possible, not exposing the communities.
I want to ask you about, it seems that nursing homes in particular are very vulnerable. Older people are being advised, as you heard from Dr. Fauci there, to reconsider putting themselves in certain circumstances. Would you tell someone over the age of, 55, 60? What's the age group that you're saying should not get on a plane or get on a cruise ship? Well,
great question. And we've got new data emerging. We know that the average age of people who are dying from coronavirus is 80 plus. We know that the average age of people who are needing medical care and advanced medical care is 60 plus. And so what we're telling folks is that if you're in an at-risk group, meaning you're elderly and or you have comorbidities, heart disease, lung disease, you're immunosuppressed for whatever reason, that you should be taking extra precautions not to put yourself in a situation where you may be exposed.
What if you're pregnant?
Again, if you're pregnant, I would advise taking extra precautions. But that said, no one under the age of 30 has died of the coronavirus in South Korea. No one under the age of 50 has died of coronavirus in Japan. There's something about being younger that is protective. But if you are in one of those higher risk groups, we suggest you avoid crowded spaces. We suggest you avoid potentially going on a cruise or taking a long haul flight, because most people are going to be fine, but we want those folks who we know are at higher risk for complications to protect themselves.
But New York State declared an emergency, and they have said you can't have visitors until further notice. Should other states be doing this? Would you advise other states to do this?
Well, that's one of the reasons the Vice President and I have been going around the country. I've spoken with three governors in the past week saying, you need to be having these conversations right now. And I would encourage folks to go to cdc.gov. There is specific guidance for audiences, businesses, schools. I met with the National Association of Evangelicals, faith leaders. We want them to be thinking now about what their triggers would be, but the risk is going to be different in different places. What you're going to do in Seattle is going to be different than what you're going to do in Jackson, Mississippi, for instance.
So you've been a state health commissioner. In fact, you were one under then Governor Mike Pence.
And we dealt with Ebola, we dealt with Zika.
And the largest HIV outbreak from intravenous drug use.
Yes.
And some point to that fact. In fact, it was a criticism from Senator Murphy here that this administration has been slow to respond to this virus. Given that Vice President Pence and you, same team, different situation, how do you respond to that? That there was a slow response then, there's a slow response now?
Well, I'd rather talk about coronavirus, but it's important for folks to know that...
But the speed of the response specifically is what he was criticizing you for not having kits in place, for not laying the groundwork.
I appreciate the question. Syringe service programs, which folks really are looking at as stemming the tide of HIV transmission in Indiana, were illegal when Governor Pence took office.
He was talking about testing kits for coronavirus.
Well, okay. And
not being ordered.
And I was referring to the HIV situation. Governor Pence showed leadership in that situation. Syringe service programs were illegal when he came in. They were legal when he left. He actually was one of the few governors from a red state that actually expanded access to care, which helped in that response. And so we have the right person in charge of this response right now. And it's a recommendation of a panel that Susan Brooks led in Congress in 2015 that the Vice President lead just such a response. Now, as far as the coronavirus is concerned, We've been leaning into containment initially, which is trying to keep the virus from entering the country. We now are seeing community spread, and we're trying to help people understand how to mitigate the impact
Containment
of disease
didn't
spread.
work. Now you're looking at mitigation.
Well, containment worked to slow the introduction of the virus and give people time to prepare. And now we know that communities need to look at how we deal with community spread, and things such as social distancing, not having large gatherings, pulling down events. Those are conversations that communities need to be having right now.
Thank you very much, Doctor, for coming and telling us.
Thank you, and stay safe by
advising.
washing your hands, by covering your cough, by staying home if you're sick. Masks do not work for the general public in preventing them from getting coronavirus.
All right, and elbow bumps. Thank you very much.
Thank you.
Doctor, we'll be right back with former FDA Commissioner Scott Gottlieb. Joining us now is former FDA Commissioner Dr. Scott Gottlieb. Good to have you back on the program.
Thanks a lot.
I want to pick up where we just left off with the Surgeon General, who said right there at the end that they are switching strategies. They are no longer looking to contain the virus. They're looking to mitigate it. Does that mean they're acknowledging what they've been doing is not working?
Well, we have an epidemic underway here in the United States. There's a very large outbreak in Seattle. That's the one we know about. Probably one in Santa Clara, maybe other parts of the country, other cities. And so we're past the point of containment. We have to implement broad mitigation strategies. The next 2 weeks are really going to change the complexion in this country. We'll get through this, but it's going to be a hard period. We're looking at 2 months probably of difficulty. To give you a basis of comparison, 2 weeks ago, Italy had 9 cases. 95% of all their cases have been diagnosed in the last 10 days. For South Korea, 85% of all their cases have been diagnosed in the last 10 days. We're entering that period right now of rapid acceleration. And the sooner we can implement tough mitigation steps in places where we have outbreaks like Seattle, the lower the scope of the epidemic here.
Let's talk about mitigation, because when I asked Governor Inslee what he is doing, and I asked him a few ways, if he'd consider doing what Italy just did,
Right.
which is essentially trying to, I mean, they're quarantining a quarter of their population in the most economically vital part of their country. This is a massive decision for them to have made. When I asked him about doing something like that in Washington State, he said, well, they're talking about more distancing and more
Right.
measures like that. Is it just that governors like him don't want to say out loud that we may have to do something like what Italy did?
Well, I think no state and no city wants to be the first to basically shut down their economy, but that's what's going to need to happen. States and cities are going to have to act in the interest of the national interest right now to prevent a broader epidemic.
Shut down their economy. You mean
Close businesses, close large gatherings, close theaters, cancel events. I think we need to think about how do we provide assistance to the people of these cities who are going to be hit by hardship, as well as the localities themselves, to try to give them an incentive to do this. Right now, if there's no economic support to do this, you don't want to be the first to go, and I think you're seeing that. This exposes one of the challenges of our federal system, that we leave a lot of authority to state and local officials, and there's good reasons why. But in a situation like this, where you want them to act not just in their local interests, but the national interests, I think we need to think about both trying to coerce them, we can't force them, but also try to provide some incentives in terms of support. And we're going to end up with a very big federal bailout package here for stricken businesses, individuals, cities and states. We're better off doing it up front and giving assistance to get them to do the right things than do it on the back end after we've had a very big epidemic.
Are you telling the White House to do these things? You used to work in the administration.
I'm still having discussions with people in the administration. I've been saying this publicly for weeks now. I think we should try to get ahead of this right now.
The president said this morning in a tweet, "We have a perfectly coordinated and fine-tuned plan at the White House for our attack on the coronavirus." And he said the news media is doing everything possible to make us look bad. I'm asking you this, not because I'm a member of the media, but because we are trying to suss out what reality is versus anxiety for the public. Is this a perfectly fine-tuned plan? And is what people are hearing on the news, as the president said, just to make him look bad?
We have a narrow window of opportunity to implement tough measures to try to push down the scope of the epidemic. What you want to do is you want to put in place mitigation steps to reduce the peak number of cases you have, to get them below the point at which the healthcare system gets exhausted. Because what happened in Wuhan, China, was the healthcare system got exhausted and fatalities rose quickly. What we need right now in terms of a good plan is a systematic approach to what you do in terms of mitigation steps and when cities should be implementing that.
And you don't see that happening yet?
There's no systematic plan for when a city should close schools, when they should tell businesses that they have to telework, when they should close movie theaters and cancel large gatherings. We leave these decisions to local officials, but we really should have a comprehensive plan in terms of recommendations to cities and in some support from the federal government for cities that make that step, make that leap, if you will.
So, but just on the anxiety question here, the administration has compared this to the flu. Is that how people should be thinking about this?
No, this is not the flu. China didn't shut down their economy because they had a bad flu season. The case fatality rate here is going to be higher all through the age ranges. This is a more severe disease. Now, it's true that you don't see the full spectrum of disease that you see with the flu, where some people get a mild disease, some people get a moderate disease, some people get more severe disease. Here, you're seeing a more binary response. Some people get mild and moderate disease, and some people get very sick. But for the people who get very sick, this could be a very dangerous disease. The case fatality rate is probably going to be about 1%. And it's not just older Americans, as tragic as that is, and we shouldn't dismiss the burden that this is going to place on older Americans. If you look at 40-year-olds, the case fatality rate has been anywhere between 0.2 and 0.4%. So that means as many as 1 in 250 40 to 50-year-olds who get this could die from it.
And this data is based on what? On China?
This data is
On
based
South
on
Korea?
reporting out of South Korea and China. Remember, when you look at the South Korea data, the case fatality rate in South Korea right now is 0.6. But the time to death is 3 to 6 weeks, and most of the cases were diagnosed in the last 10 days. Time to hospitalization is 9 to 12 days. So most of these people in South Korea haven't worked through the severe stage of this disease. The case fatality rate will go up. And one more point, you have to make a distinction between the case fatality rate and the infection fatality rate. We talk in medicine about the case fatality rate. How many people who get the disease will die? Some people are talking about the infection fatality rate. How many people who get the infection will die? That's not what we focus on in medicine, because we know that some people get the infection but not be symptomatic. We typically don't count those. We count people who get the disease. And for that, the case fatality rate it might not reach 1% in our system, but it might get close to that. It's not 0.1, and that's the seasonal flu, and it's not 0.05, and that's a mild flu season.
And to get there, you need the adequate number of tests out there and testing to happen.
Which we're getting.
Which we're getting
yeah.
there. All right, thank you
Thanks
very
a lot.
much for your insight. We'll be back in a moment with our political panel.
I will no longer seek to be the 2020 Democratic nominee for president.
I am ending my campaign.
I am, with great enthusiasm, going to endorse Joe Biden.
I entered the race for president to defeat Donald Trump. And today, I am leaving the race for the same reason.
One of the hardest parts of this is all those little girls who are going to have to wait 4 more years.
And to quote former Vice President Biden, you heard him at the top of our broadcast, what a difference a week makes. This has been quite a turnaround for him and this campaign. So we've gathered some of the very best in the business for analysis today. Amy Walter is national editor at Cook Political Report and host of The Takeaway. Dan Balz is chief correspondent at The Washington Post. Joel Payne is the Democratic strategist and a CBS News contributor, and Leslie Sanchez is a CBS News political contributor. Both are very familiar faces to our CBSN viewers, so it's great to have all of you here. Amy, a week ago.
I can't believe it was just a week ago.
Just
it feels
a week ago.
A year and a half ago.
And we were talking about whether a single win in South Carolina could be enough to keep Joe Biden going in this race. Then Tuesday happened. Now we're calling it a two-man race.
Right.
What drove this turnaround?
The most important person in the Democratic primary has always been Donald Trump. And being able to beat Donald Trump was the key issue voters had been telling us for the last 2 years. They just couldn't quite figure out who the best candidate was to defeat him. I think after Nevada, there was this consensus, especially here in Washington, but even among regular voters, that the candidate who was seen as the most quote unquote electable was not Bernie Sanders, but he was on the path to winning the nomination after Nevada. And you put that in combination with Joe Biden's big South Carolina win, thanks in large part to Congressman Jim Clyburn's endorsement, and then to get all of those candidates who dropped out to endorse Joe Biden immediately is really phenomenal. I talked to one Republican who said, well, I guess Democrats they're just more disciplined than we are. We never could have done that in 2016. I said, they're not more disciplined than Republicans. It's that Donald Trump represents a much more existential threat. At least Democrats see it that way. That's what brought them to the table. I don't know if a President Marco Rubio or a President Jeb Bush would have gotten Democrats to do what they did with Joe Biden this week.
Dan, what I hear Amy saying is basically Democrats didn't fall in love in the week. They fell in line, the party. and align themselves here.
I think they did, and I totally agree with Amy that the issue was who would they rally around eventually? Because we knew that Senator Sanders had a very loyal base of support, but what we saw in both Iowa and New Hampshire, and to some extent in Nevada, was that he wasn't the overwhelming choice. He was the choice of 25 to 35% of the Democrats. That meant there was a big group that was looking for somebody else. And they were looking for some kind of cue or clue as to what to do. And African American voters in South Carolina gave them that cue in a very strong way. And that brought everybody together, in a way that no one could have anticipated.
Senator Sanders, though, Joel, had been campaigning and on programs just like this one would say time and again that he was unique in being able to bring in young voters, motivated voters to the Democratic Party. But then on Tuesday, he had this to say.
Have we been as successful as I would hope in bringing young people in? And the answer is no. We're making some progress. But historically, everybody knows that young people do not vote in the kind of numbers that older people vote in.
He says he didn't get the youth vote the way he expected. Black voters didn't vote his way. Latino voters, though, in certain states did stick with Bernie Sanders.
They did. It's not the coalition that you have to build to win in the Democratic primary this time. It's funny. We were told to expect a revolution. Bernie Sanders talks about a revolution, except we thought it'd be from the left of the party, not from the center left of the party. It was senior voters. It was working class folks in the middle of the country. It was suburbanites, college-educated women, and it was African Americans. That's the revolution we saw. We saw surges in all of those numbers of voters. We've even seen a surge in turnout in some of these early states in Nevada, New Hampshire, and South Carolina. Big numbers that actually spell pretty well for Democrats this November. And I think the Biden campaign has been saying, as Amy said, the animating issue in this primary is a desire to defeat Donald Trump. And I think that they feel like that is the biggest reason why the wind's at their back right now.
Did you think that there would be a time when you would say African American voters have led the way for the establishment, that everyone's following them?
Totally.
On the nominee?
I not to toot my own horn, but I actually wrote it about 4 months ago. And I know there are a lot of folks, not just African American,
but beyond South Carolina.
Oh,
yeah.
Totally. Absolutely. Look, African Americans are the core of the Democratic base, and particularly African American women are the most reliable Democratic constituency over the past few elections.
Senator Harris has reminded us of that time and again, but she didn't get the support enough to stay in the race. This morning she's out there and she is endorsing Joe Biden. Should we expect to see more of her?
Totally, and look, I think obviously she is a clear candidate for the vice presidency. That folks would kind of make that grouping, that Biden-Harris grouping. But you also have to think about, if you're Joe Biden, how do you pull in those Sanders voters if Bernie Sanders is not the nominee? How do you pull in those folks to make sure that they do not feel ostracized and alienated by the party? Does Kamala Harris do that? Is there another person of color, younger woman candidate who can do that? Maybe there's somebody else out there.
Leslie, I want to ask you, Senator Warren, we played that clip of her talking about promising all those young girls, and they're going to have to wait another 4 years. She also said something very specific to gender and how it factored in this race. Let's listen.
Gender in this race, that is the trap question for every woman. If you say, yeah, there was sexism in this race, everyone says whiner. And if you say, no, there was no sexism, about a bazillion women think, what planet do you live on?
What did you make of that? We didn't hear this from Senator Klobuchar when she dropped out.
No, and I think that's an interesting distinction that you have there. Traditionally, on the road to the White House, there are these unique challenges. There are narrations that they have, kind of frameworks that they have for male candidates. They're authoritative, the leadership style. It bolsters kind of their sense of commander-in-chief. For women, in contrary with those similar traits, or more feminine traits, it's viewed through a different lens. In many ways, sometimes women are categorized as ditzy, as a witch or as somebody who's a media darling. We can never really look at them in a whole in terms of what they represent.
So you agree with her?
I think there's some legitimacy to that, but let's look at the distinction. She raised over $100 million. She's coming off the back of a Congress, a Democratic Congress, where more women were elected than they had historically, and the 18 million cracks of Hillary Clinton, who was at the top of the ticket in 2016. So there has been momentum for female candidates. It's hard for candidates, male or female, to face that their policies did not connect with the vast sum of voters who were looking for a nominee, and in this case, to take on Donald Trump.
You agree?
Yeah, well, and every campaign has to meet the moment, right? And this moment I like Joel's about the revolution of the center, which was this was not a time when voters were willing to take a risk on a 38-year-old candidate who's openly gay, not willing to take a risk with a candidate in Elizabeth Warren who also was seen as too far to the left, might not be able to beat Donald Trump. And if you talk to strategists, I'm sure that Dan has heard the same thing. Democratic strategists will tell you, we sat in focus groups where as many women said, I'm worried that a woman can't beat Donald Trump, as did men.
Dan, you had an extraordinary week for President Trump, not just because of the coronavirus that we have been talking about. It was not a good week for him in the financial markets. You had the airline industry getting hit hard. Southwest CEO says it has a 9/11-like feel these days. The Federal Reserve stepped in and took extraordinary measures, cutting rates. Is the president losing his best pitch for re-election?
Well, we don't know how long this is going to last. Right now, we're in a terrible moment, and the sort of the economic carnage that we're beginning to see is going to continue to ripple. I mean, listening to the experts who were on here earlier today, we're at the front end of some of this, and it's going to get worse. So in that sense, the biggest issue that he's had going for him is a strong economy, and he now faces a period in which that's not going to be the case. I think the issue is going to be how long does it go on, and what do people think about what was the reason for it and the degree to which he gets the blame as opposed to somebody else. But we're going to go through a bad period, and if you are the president of the United States, that's never good politically for you.
Margaret, I think the worst thing that happened for the president was his comments at that town hall about Social Security and Medicare. I can tell you, as someone who's spoken to a few folks near the Biden campaign, they saw that as a fastball right down the middle for Joe Biden to start to make his general election case against Donald Trump. It's not the first time he said it, but the fact that he would say that, to combine with all the other things that are happening, that's very ominous politically for the president to be talking that openly about
Indicating potential cuts.
Yes.
No, I was going to say, I think the president is trying to influence the nation to keep that stiff upper lip, right? To stay informed but not to buy into hysteria as the public sentiment tries to go up. And the reason it's becoming so politicized, which is the unfortunate part, and it's hard, I think, Margaret, what you're trying to do is decipher fact from fiction here, is because there is this lane across the Democratic kind of thinking and what they're saying and their messaging. Is this a failure of the presidential management style, just similar to George W. Bush and Hurricane Katrina? Are we falling in that line? And the president's going to push back and say, I have the task force. We are, aligned, working private industry and the federal government, $8.3 billion. That was a joint Republican-Democrat initiative. That's where this gets political.
And it'll be interesting to see what a new chief of staff at the White House will do and what impact he will have. We will be right back. That's it for us today. Thank you for watching. Until next week, for Face the Nation, I'm Margaret Brennan.